The University of Maryland Medical Center in Baltimore did something recently that demonstrates exactly how broken America's healthcare system really is, and it shows exactly why we need Medicare for all. So they treated and discharged a patient with nowhere to go. So since she didn't have anywhere to go, they dumped her off at a bus stop, and she was half naked. She had a medical gown on, and they left her. So a man named Imamu Baraka filmed what happened, and I'm going to show you the video. It's pretty disturbing, but I would encourage you to challenge yourself and watch it, because we can't turn away at things that make us feel uncomfortable. We have to realize this is what's happening in the United States in 2018. So this isn't the full clip, it's a portion of it, but watch it and then we'll talk about it afterwards.
Wait, so y'all just gonna leave this lady out here with no clothes on? So you all are just gonna leave this lady out here like this? So I'm assuming that you all are with the security department? Okay. Is there a supervisor available?
I am a supervisor.
So you all are okay with leaving that woman out there like that?
She was medically clear.
Ladies and gentlemen, I'm at a local hospital where individuals have left a patient half naked on the city streets, and it's about 30 degrees out here right now, and I am not sure why this is even happening, but we're gonna find out. Ma'am, are you okay? Are you okay? Huh? Are you unable to speak? Are you okay, ma'am? Do you need me to call the police? Why don't you go and sit down, ma'am? You don't look well. Come and sit down. Come and sit down. Ma'am, come and sit down. Ma'am, why don't you come and sit down? Ma'am? 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 Come and sit down. Let me get you some help. Come and sit down.
That was incredibly difficult to watch, obviously. And if we had a Medicare for all healthcare system, that wouldn't have happened. Because the reason why they presumably dumped her was because, well, she was treated at the emergency room, and then afterwards they discharged her and realized she probably couldn't pay or didn't have insurance, so they couldn't keep her there because staying overnight, that costs a lot of money. So they dumped her. But in a system like Canada, where they have a single-payer healthcare system, they would have kept her until she was coherent, until she was in the right state of mind to be left at a bus stop. And that video, mind you, goes on for several more minutes, and it gets really disturbing. So she starts crying, she begins grunting. I mean, you can just tell that she's really frustrated, and she wasn't in the right state of mind to be on her own. And then you see that she didn't have anything on underneath that medical gown. Like, her whole back was basically open. It's sickening. Things like this, it's happened before. Thankfully, Imamu was there to capture this on video. But if you see the documentary Sicko by Michael Moore, there's security camera footage of hospitals dumping patients off once they've treated them and they have nowhere to go, so they just leave them. Patients stumbling around, not knowing really where they are, not fully coherent, not able to really make decisions for themselves yet. Yes, they might have been medically treated, but I mean, mentally, if you just undergo something that is a traumatizing medical procedure, then clearly you're going to need more care. But I mean, in America, hospitals, the medical industry, this is a business. They just want to treat patients and, churn them out quickly, get them out. It's kind of like a restaurant. People come in, they order their food. You want to get them in and out as quickly as possible so you can see the next customer and make more money. This is how hospitals operate. And that's why our system is so fundamentally broken, because hospitals and healthcare systems, there shouldn't be this profit incentive. If you have a healthcare system where profit is the overall goal, where hospitals prioritize making money over the treatment of patients, this is what happens. This is the outcome. Now, this video quickly went viral for obvious reasons, because it's just appalling. I don't know how anyone can watch that and not feel something, inside. I was angry. I was hurt by this video to know that this is still happening to fellow Americans in this country. So, the hospital was basically forced to respond to it. And the president, his name is Mohan Suntha, said this.
I really want to start by apologizing to the patient, her family, and the entire community that we serve for what occurred as a patient was leaving our organization Tuesday night here at the Midtown campus. We believe firmly that we provided appropriate medical care to a patient who came to us in need. But where we absolutely failed, and where we own that failure, is in the demonstration of basic humanity and compassion as a patient was being discharged from our organization after having received that care. As a physician who has spent my entire professional career as part of the University of Maryland health system, I share the community's shock and anger at what occurred. And as leaders in this organization, we own that responsibility to ensure that as we investigate the breakdowns that occurred, that again, consistent with the fundamental tenet of our leadership approach, that we hold each other accountable for the actions that occurred Tuesday night. Again, I want to be clear that what was witnessed on that video was not a part of the patient's medical care that was delivered while they were within the institution. So we are, in fact, conducting an in-depth analysis of what occurred. We are trying to understand the points of failure that led to what was witnessed on that video. We are holding individuals who made decisions accountable for those decisions, and that is throughout our organization.
So there you have it. They're denying that they provided her with inadequate care, and certainly we don't know if that's the case. I believe that they thought that she was clear, but I mean, one thing that's evident is that she clearly shouldn't have been released. She wasn't in the right state of mind. So even if they gave her the treatment that she needed, something wasn't right there. This is a young woman. She shouldn't be acting like she doesn't know where she is. If, she wouldn't be acting like that if something weren't seriously wrong still. Or maybe she needed a few extra days to recover. But again, the goal is to just treat them and get them out as soon as possible. And if they don't have anywhere to go, sometimes this is what happens.
Support this podcast by becoming a patron at patreon.com/Humanist Report.